Singing River Health System is now expanding its mental health services, and here now to talk about that, Dr. Roger Ridgeway. He's a psychiatrist with the health system. Dr. Ridgeway, thanks for joining us today.
Thank you.
Tell me a little bit about what you all are offering, Dr. Ridgeway, in terms of these televisits and why you think this is so important right now with all of the social distancing in place and a lot of people suffering from mental health issues because of the COVID crisis and then other issues they may have been dealing with before this.
Absolutely. So we knew this being the biggest disruption in modern day society, we had to jump on a quick way to see face-to-face visits as we normally do in the clinic. So we went with telehealth visits, which we're offering everyone, and we want to make that known that we're here for the community. We virtually have the patient call in, we send them a link, and we're able to communicate face-to-face. And we also stress the importance of our EAP program, which is an employment assistance program for those frontline workers in the hospital, nurses, doctors, ancillary services. And that would allow them 6 free visits through that program.
All right. And what are the specific issues that you see with the frontline workers? I mean, there are so many of them out there right now, and they are putting themselves at risk.
Absolutely. I think the implications will go, months ahead, years ahead. We're seeing some sleep-related issues, anxiety, reasonable responses to what's going on in the world today. And I think we're going to see a lot more of it as the months go by. And, when you're working real rigorously in the hospital, we're probably not seeing as much now, but as I said, as time goes by, we'll continue to get those phone calls and more interest of seeing folks with those difficulties.
And of course, with this statewide shelter in place in order now in Mississippi as well, there's a lot more social distancing. That creates problems too for people in the community, especially, I guess, the elderly. Are you seeing a lot of issues with that right now?
We are. From human nature, we are social people, but we really need to focus on the physical distancing. We can socially still connect through technology, and we're really seeing family support come through with some of the elderly, and we've seen folks move to other areas temporarily to get that family support. That's going to be main key right now, and to communicate, with families, as much as possible.
I know the televisits with some of your people there would be helpful, but what about things people can do on their own to help get through this crisis? Not only just the regular exercise and meditation, those type things. For people who probably perhaps can't get out, like the elderly we mentioned, what can they do? What can their family members do when they can't visit them?
Well, I'll tell you what they shouldn't do is probably ruminate and, engage in too much social media or news that could be sensationalized at times, but also with ability to Skype or connect with family members. There are virtual home workouts that are being put on by gyms. They should also, pick up something of interest. What I'm seeing are folks are really adhering to tools they've had from previous crises that we've faced before, and I ask, what did you do during that time? And that may be drawing, picking up painting, or another inspirational book or something of that nature.
Right, those are all things you can hopefully do in your home environment. So these are all good things. And are you concerned about as we go forward with the time being stretched out even longer? What are some symptoms that people should look for? I mean, a lot of people have at least a little bit of depression right now, but at one point, does someone need to seek help?
It's a great question. So I think all of us get sad one day or another, and we get tired and anxious, and you'll have some sleepless nights based on the global pandemic. But when you start to see somatization or physical symptoms, severe headache, GI symptoms, your daily work or homework is being affected, these are the things that we have to take note of. And we want people to accept the fact that this is going on. You'll see ranges of negligence to overreaction, but we have to accept there is a problem, and we have to put the note out that it's okay to talk about it.
All right, Dr. Roger Ridgeway from Singing River Health System, thank you so much for joining us today.
Thank you.
And developing now, the 4 cruise ships that have been docked at the Port of Gulfport